This is one of the feel-good articles that bring hope to parents of autistic children with speech delay. At the end of this video, we will share some of real cases of nonverbal autistic children who were able to find the ability to speak at later age. Disclaimer: our interpretations and opinions in this video should not be taken as medical facts, professional advice, nor treatments. Always consult with your child's behavioral therapist/specialist and/or doctors for advice. Please don't forget to support our effort in gather information to parents and creating learning contents for autistic children. Let us get started. High percentage of children with autism overcome language delays, study finds. A child with autism who demonstrates nonverbal intelligence can overcome severe language difficulties that occur early in life. Many parents of autistic children have heard that their child is unlikely to ever talk if he or she isn't doing so by the age of 4 or 5. Some academics disagree with this theory, citing examples of children who learned to speak throughout grade school or into adolescence. These encouraging speculations have now been confirmed by a research involving more than 500 kids done in 2013 and published in the Pediatrics Journal. Researchers at the Center for Autism and Related Disorders in Baltimore examined data on 535 children aged 8 to 17 who had been identified as having autism and had substantial language impairments at age 4. None of the toddlers in the study had mastered phrase speech, the capacity to communicate using more than 2 or 3 words such as, "I want to play." The study's findings revealed that the majority of these children did eventually pick up language abilities. Nearly half of them attained fluency. 70% could talk in simple phrases. The nonverbal IQ of a kid and having less social impairment were both significant predictors of that child's future capacity to acquire phrase or fluent speaking abilities, according to the study. Surprisingly, the researchers discovered that a child's level of repeated behaviors and constrained interests had no impact on their likelihood of developing language. Additionally, demographic factors such as parent income and education level as well as a child's psychiatric traits were not related to whether a kid with a language delay reached phrase speech. The outcomes, according to the expert, social and nonverbal communication abilities are actually the foundation of language. Children who possess these abilities typically speak more effectively than those who do not. These findings gave parents hope that their language-delayed children would have higher chance to develop speech in elementary school, or even as teenagers. This also shows that focusing on these areas in early intervention will help to promote language by identifying crucial determinants of language acquisition, particularly the significance of nonverbal cognitive and social abilities. Researchers at the Children's Hospital of Philadelphia's Developmental Neuroimaging Laboratory gives the results credibility because of the study's size, as it is very difficult to get a sample that huge in an autism study. Positive results shared by parents. This is a very common question asked by concerning parents. Has anyone's child been diagnosed as nonverbal ASD and they eventually started speaking? If so, what age did they start to speak? A grandma said, "My grandson was nonverbal and was diagnosed at 3 with moderate to severe autism. Now he's almost 6 and diagnosed with mild to moderate autism and is never quiet. Lots of early intervention, occupational and speech therapy, special ed preschool, and is now in a regular kindergarten class with some modifications. He can read on at least a second grade level, can tell time, does math in his head. Truly surpassed anything we thought would happen. Never give up." This teacher said, "I had a student that was. He was told around 3 he would never talk. I taught him in grade 3 and he could talk non-stop. I learned a lot about the Titanic that year. He gave an interview on the news for something I won for the school and he rocked it too. He went to our Sunshine preschool in my school where they worked intensively with him. It included speech, AAC, outside speech, and a lot of time at home with the activities the parents were given. He is in grade 8 this year. The following proud mother said. Yes. Diagnosed at 21 months and started talking between 4.5 to 5 years old. Hasn't stopped since. He's now 22 years old and a college senior. My son was diagnosed nonverbal and starting to talk at age 8 years old. My son was nonverbal until the age of 7. Years of speech therapy and me working with him. He is 24 now. My daughter was 4.5. She's always babbled or had her own language. She's starting to say 3+ words at a time. She will say some sentences out of nowhere at times. We use a Prolog app and that has helped tremendously. Mine was nonverbal, now she is. She was diagnosed at 3.5 years and started talking at age 6. As you can see, with patient, persistent and the appropriate help and services, nonverbal autistic children do have a good chance to gain the ability to speak. So don't lose hope, don't give up and never stop fighting for your child.